Chapter 12, Treatment of Personality Disorders. While there are technically no FDA-approved medications for treating personality disorders, this chapter explores some common helpful medications or combination of medications used day-to-day practice for symptom reduction and control. Historically, psychotherapy has been the mainstay of treatment for personality disorders as opposed to pharmacotherapy. Medication treatment for personality disorders is fairly new in the field of psychopharmacology. Clinicians once believed that the use of medications in the treatment of personality disorders would be counterproductive because it would interfere with the psychotherapy. But today, both psychotherapy and psychopharmacology treatments are important and we should consider and use together. As a note, numerous forms of psychotherapy have been tried, including dynamic, behavioral, cognitive, supportive, and dialectical. As a rule, the best way to approach these clients is to use a combination of various orientations. When we are looking at personality disorders, for many years there was an assumption that Axis I disorders arose from biological predispositions and Axis II disorders were more environmental stressors, which is why personality disorders fell in the previous DSMs under Axis II. Keep in mind that the genetic process needs an environment in which to become expressed. Environmental stressors may turn genetic influences on and off across a lifespan. Research has suggested that personality disorders are a biopsychosocial entity caused by complex interactions of psychosocial and biological factors. Before considering pharmacotherapy for personality disorders, the clinician must obtain a comprehensive assessment. Obtaining a complete psychiatric and medication history is not only important but crucial. The focus is on targeting symptoms and their response to the pharmacotherapy rather than treating the diagnosis. With client permission, an interview with family members will be helpful in making a personality disorder diagnosis. Sometimes clients with personality disorders may have a substance abuse or dependency. So it is important as clinicians that we also do an assessment of substance abuse or dependency, as it may mimic a diagnostic symptoms of a personality disorder. Family history is also valuable and may suggest the existence of biological vulnerabilities for mood disorders, drug and alcohol abuse, and perhaps personality disorders. As with other disorders, it's very important to look at if the client has any medical conditions, as well as taking medications that may affect them cognitively, behaviorally, or affect their affect. No specific medication has been identified for individuals with a personality disorder. Based on the symptoms the client is exhibiting, that will play a part on medications that might be prescribed, if any at all. If the client has a personality disorder that falls more under the cluster A, then we may look at antipsychotic medications at a low dose. If they are more of a cluster B, then perhaps SSRIs or atypical antipsychotics. And finally, with the cluster C personality disorders, we might use SSRIs or benzodiazepines. If a client has a history of substance abuse, it is still always important to avoid benzodiazepines.